Anderson's continuum is comprised of 3 stages and is based on the assumption that professionals will be involved in some amount of consultation with others for the duration of their career. The continuum mandates that the amount and types of involvement of those consultative relationships change over time. As the degree of control from the supervisor decreases, the participation of the student increases. One thing that's important to note, however, is that none of the stages are time-bound. Depending on a number of personal and professional variables, which will be explained in more depth later, some students may begin their first clinical experience well beyond the first stage, and others may never reach the 3rd stage. Anderson's continuum has important implications for SLP students during their graduate programs and their clinical fellowship years. According to a study by Irwin, lack of available time was perceived as the variable that most influenced the use of the directive style of supervision, because collaboration takes more time than directly modeling or making decisions and relaying them. Although a direct style of supervision has its place, McRae and Brasseur point out some of the hazards of implementing this style. First, they emphasize that the purpose of supervision is not cloning. The risk of modeling clinical behavior for your supervisee without also implementing other styles and strategies, such as joint collaboration, has the risk of attempting but failing to create a mirror image of the supervisor in the student. This not only sets the student up to feel like he's failing, as it is next to impossible to adopt and replicate another person's clinical behaviors, but neither is it consistent with ASHA's standards of supervision. So far, we've discussed the importance of identifying our expectations, needs, and perceptions of our roles and responsibilities in the supervisory relationship. Next, we'll review and discuss important things to keep in mind when communicating these expectations. Rating scales that can help guide effective and efficient conferences will be reviewed. Lastly, methods will be suggested for how to maintain accountability to yourself and your student. If supervisors and students operate from different sets of assumptions about what should take place between them, then communication barriers are raised before the interaction even begins. Discrepancies between expectations about roles and their actual roles lead to confusion and conflict. A number of studies have shown that individuals expressing such role conflict have been found to be less effective than others, suggesting that the consequences of this conflict may not only be ineffective performance for the institution, but also frustration for the individual. In short, sharing of goals and objectives, defining needs and expectations, and clarification of differences and similarities in perceptions may be one of the most important components of the entire supervisory interaction, probably forming the pattern for the entire relationship.